why physician retention is such a key strategic priority right now. Aaliyah, if you want to kick us off here.
Of course, and good afternoon, everyone. I think you mentioned this perfectly. This sets the foundation for today's discussion. So I'll break this up into three portions: community, organization, and then, of course, recruitment. So, from a community standpoint, I think we can all agree the patient impact perspective is so critically important. Retaining physicians helps maintain that continuity of care, which is a critical piece for patient satisfaction and outcomes. We all know also from being within the healthcare space that when physicians stay within an organization for a longer period, they build those strong relationships with their patients, which ultimately leads to that better patient trust and adherence to treatment plans. But let's bring it back to the organization, right? And so, why so many of us are here today is the impact that that turnover has on the healthcare organizations. So, recruiting and training new physicians, as we all know, requires significant time, resources, and utilizing the third party resources, such as recruitment firms, only add to these costs. And we haven't even touched on the day to day impact. So, financially, not being able to provide certain services will only cause further concerns, not only within the community, but for that return in revenue. So, looking at the revenue generating potential of physicians, and we can definitely share this report with you after to all the attendees, but AMN Healthcare does conduct an annual report. And for our 2023 physician billing report, we were able to look at all of the annual billing by physicians over 18 medical specialties to commercial payers. And after doing so, it was shocking to see that each provider generated on average 3.8 million in billing through various specialties to commercial payers. And so just thinking about that number, 3.8 million, and the impact that that has by not having that provider there to do those billing. And so that revenue loss is so significant and something that I believe we can all get ahead of. And then from a recruitment standpoint, it's vital. It's a selling point that many of the organizations we work with simply forget. And so when physicians feel valued and supported, they are due to stay at the organization for longer, which only leads to a higher morale and job satisfaction. But from a recruiting standpoint, it's a huge selling point. When recruiters are able to say, the provider's been with the group for 10 years, or the providers have stayed within the organization for X amount of years, this changes the entire dynamic and storyline of why you need a provider. Recruiting due to succession planning and growth is always a better selling point than recruiting due to departing providers. And so when we're able to use this and show the tenure that your group has, you have a leg up in the industry. And so I would say those are the three factors that stand out to me.